Hi, it's March 17th, St. Patrick's Day. It's Noel Williams from Optimal Health Associates. I'm going to do another little COVID-19 discussion today. I get to be a great example. I have a exposure to a COVID-19 patient. And when I'm saying I have an exposure to a COVID-19 patient, it's someone with COVID-19 who's positive. It wasn't a patient in our practice or someone who'd been to our office. It was a different exposure situation. But so I've been exposed. So I have to take several steps. The first one is I have to self-quarantine. So I get to spend some time with my lovely family and they get to kind of stay away from me. But you know, one of the things about exposure is I've been around them already. So we just have to wait and see what happens with everyone. We've been on our zinc, we've started our melatonin, and I feel fine, but we'll just have to see. One of the questions that came up from this is, do you have to worry if you hear about someone you know who's gone into quarantine because of an exposure and you may have met the person or talked to the person who was exposed? And the answer is no. Remember, the vast majority of people who are exposed aren't going to probably get the virus from their exposure because they were too far away. They didn't touch the person. They didn't have enough contact to be affected. But there's always that possibility. So if you know someone who's gone into quarantine for exposure, make sure you touch base with them to get their final result or how they did per se. Since I see tons and tons of humans in the office and all over the place, I actually did get tested because I'm day 7 from my exposure. And that's one of the things that has completely changed as of today. There are tests everywhere. Integris has tests, St. Anthony's has tests, a variety of physician offices have tests. I mean, you can get a COVID-19 test suddenly today, finally. And so it's what the Trump administration has been working on, and all these private labs. DLO has a test, CPL has a test, LabCorp has a test. Most of the hospitals have quick and easy testing now. So if you're worried about an exposure or worried that you have symptoms, you can get tested. Really, the testing criteria for most people is to wait till symptoms and then you would go get tested if you've been exposed. My case is a little different since I've been a healthcare provider and I've seen a lot of people over the last week and a half, or really, but my exposure was a week ago. So I need to make sure I know for the sake of the patients we've seen and my staff. So we're doing that a little differently. But for the most part, we want to wait till you're having symptoms. One thing about Oklahoma, for those of you who are continuing to think this is all silly, is we actually have now 17 cases. I have to look at the computer at the Oklahoma COVID site. And out of those 17 patients, only 4 are over 65. 8 are between 18 and 49 in the infected group. 5 are in the 50 to 64, and 4 are in the 65 and older. So remember, lots of younger people get infected with COVID, and we just now have to see how everybody does. We'd anticipate the younger people to do better than the older people, but we're going to keep our fingers crossed at everyone. You can probably plan for the number to hit 100 within the next couple days, and probably 300 to 400 by the end, probably by early next week, but we'll just have to see. David Holt, the mayor of Oklahoma City, has put in some restrictions or limitations on restaurant service, gyms, movie theaters, food courts at the mall, etc. You may want to check with one of the local news channels to keep up to date with that, but figure the quarantine started or is getting started now for the public, and that will probably get more intense. I also was called by some people from the National Guard, and they've been put on alert now and are expecting to be called up sooner rather than later. So I think we're heading towards what I've been talking about, which is some kind of formal quarantine in the next several days or so. That's our doorbell. So that's really about the summary today. I think I mean, to be clear, I'm not nervous about having the exposure to COVID-19. I've been taking my zinc. I started my melatonin. I'm just optimistic because I've done the things that we're supposed to do to protect ourselves. So everyone stay calm and soldier on, and we're going to get through this. Take care.